G'day guys, welcome back to the channel. What we're going to talk about today is a really powerful shoulder stretch. It's quite useful for anyone who has shoulder pain, but also anyone who's interested in just making their shoulder move better. So we're going to go straight into the stretch, and then after the stretch we're going to talk about why it's really important and how it can really help you sort of undo a lot of the dysfunction that creates shoulder pain. So to start with, we basically need a ball, so a trusty lacrosse ball, a tennis ball, anything that you feel is comfortable. And what we're going to do is we're going to lie down on top of the ball and use that to free up our shoulder. But before we begin, we always want to make sure that we do a test first and compare that to what happens after the exercise so that you're comfortable that something's actually happened. So for me, what I like to do with my patients is, and you can't see very well here, but we want to take your arms up as high as you feel comfortable. So as far as you feel you can go before you feel like you start to arch your back, just as high up as you can get to. So for me, I think we're about even, my shoulders are about even there. So we want to take note of that so that when we do the exercise and retest it, we want to feel like it's genuinely further straight away. So what we want to do here is with the ball, we want to place this ball into your upper back. So just sort of inside from the shoulder blade, if we say the middle of the spine where the bumps are here, we want to be just sort of up against the bumps, so not right in the middle, but right in the middle and off to the side a little bit. And what we're going to do is as we lie down, we're going to have the ball in that position. And then what we're going to do here is, as you can see, the ball is sort of right up in there, right up next to the spine. So all we're going to do is we're going to bring the arm up and over. And we want to go up as high as you feel comfortable until you start to feel that you sort of meet a little bit of resistance. So for me it's here, and then what we want to do is we want to simply oscillate in and out of that position. And what you should feel is, in a very short amount of time, is it should feel like that resistance starts to go. And the reason why this is important is because I'm on the rib, the upper back, the thoracic joints, and I'm just using movement to free up those joints. And eventually you should be able to get your arm to the ground. And then what we want to do is we want to move the ball down a little bit and then do the same thing. So we want to work through these stiff upper back joints and get them to free up. And then as you can see, as we start to do this, my arm starts to go a little bit lower and lower and lower. And then after a short amount of time, you should feel like that forearm starts to get close to the ground. And so we want to work our way all the way down to the base of the shoulder blade, but also all the way up to the base of the neck. So as you might be able to see here, I'm pretty much right at the top of my shoulder, right at the top of my upper back. This is where the first rib is, and this is often a restrictive point for a lot of people. So we can do the same thing from this position, but here we might need to lift your bottom up a little bit to get a better angle down through the rib, or down through the rib as it attaches into your upper back. And then we want to repeat the same thing. So arm comes up, and then over, and we want to keep going until you feel like it starts to give and it starts to free up. Now you might find this will take a little bit longer than it is for me to free up, but the idea is that you want to start at the point where you feel you're restricted and then just consistently try and work your way down until you feel like you've sort of cleared that range a little bit. So the first part of this exercise is basically making sure that if this is your spine down the middle at the back, you're just off to the side, and then you're using using your shoulders, using your arm to sort of shear that tissue free, and then we want to work up and down that position. Now we know that the upper back has all the ribs. They start from the back, wrap around to the front. We spoke in a previous video how upper back stiffness has a lot to do with chest tightness in a compensatory mechanism. But it goes to show that there's a whole bunch of ribs right at the back, all the way out and around. We want to make sure that we free those up as well. So instead of having the ball just next to the spine, we want to move it out a little bit closer to that shoulder blade and repeat the same thing. So how it looks again, when we're trying to get into this position, we're having it right. So we're starting in the middle, we're rolling out pretty much towards where the shoulder blade is, and then we're doing the same thing. So this time, again, it's quite tight, or it feels a bit stiff for me. And what we want to do is consistently get this to free up. And then you should feel in no time that it's a little bit looser than before. And then it's just up to you to move up and down based on where you feel that restriction is. And once you've cleared this all the way down to the base of your rib cage, you can try coming out to the side and just trying different angles with your arm to see if there's any residual stiffness there that that doesn't need to be there. Now, as I said before, we always want to do a test and a retest so that you know that you've done something. You don't have to take anyone's word for it. You don't need to guess whether you've done something you can see in real time. So me having done this shoulder, if I take this one back up again, in a perfect world, your arm should then feel like it goes back further than it did before. So I think before it might have been sort of here-ish, and now it feels like there's more room to move, because what we've done is we've taken this stiff block that would normally keep my shoulder or someone else's shoulder from exploring full range of motion. We've taken that off and allowed more normal range of motion to occur. So we want to make sure that we do it to both sides. So again, starting at the middle, not right on the spine, just off to the side a little bit, so you're hitting the spinal joints. Clear that all the way up and down. Come out to the sides so you're on the rib cage itself. And there's a lot of those individual ribs that can get stiff and tight. Making sure that you're using shoulder movement to shear those tissues free. And obviously spending some time on the other side as well. Now, it's a great exercise to do on the floor in front of the television. You can do it up against the wall if you want to. It really just depends on what you feel comfortable doing. So the idea is you want to spend enough time on the stiff spots, the tight spots, until you feel like you've made a genuine change. And then making sure that once you've done that, you recheck your movement to make sure that it's moving better. Now, as we said at the start, we want to ask the question, well, why is this important? And what a lot of people don't realize is a large majority of shoulder pain and shoulder dysfunction is obviously a dysfunction of the shoulder itself, whether you've torn a rotator cuff muscle, you've damaged a labrum, you've developed arthritis or a tendonitis, whatever it is, or a bursitis. But the reason why that happens is heavily factored into by the upper back and the neck. Because for your shoulder to move normally and to function normally, your shoulder blade has to basically move and slide up and down your back with ease. And if we get a bit stiff and tight, often because we're in these rounded sort of crappy shapes a lot, the upper back gets stiff and it basically creates a bit of a block for normal shoulder motion. So instead of having your tissues being able to explore their normal function as per normal, they're often having to compensate for accrued stiffness and tightness, whether that be the joints or the soft tissues over the top. So for a lot of people who have that shoulder dysfunction, they spend so much time trying to massage their shoulder, strengthen their shoulder and their rotator cuff, strengthen their upper back, but they don't necessarily spend as much time trying to de-stiffen that stiffness, that roadblock that stops normal function. So if you have any shoulder dysfunction, it's a really, really simple thing to do. If you have the ball in the back there and you feel like it starts to create some pain, if you feel like your shoulder jams up, then just don't go as far into that range. If it feels too aggressive, it won't for a lot of people, but if you're someone who does feel like it's jamming up or irritating your symptoms, don't add in the shoulder movements. Just stay there, let the ball press into your upper back for a few minutes, then move it up to the next spot, hunt around for where those stiff spots are in your back. And then as that tissue gives, you should be able to feed a lot more slack into the shoulder, and then eventually it will feel fine to do that. So it's always really, really important to be aware that any shoulder dysfunction is heavily influenced by the state of your upper back. Most commonly stiffness and tightness. This is a fantastic way to do that. So the one spot to pay extra attention to is right up at the base of your neck. Again, many don't realize that your rib cage is all the way up, pretty much above, the first rib almost sits above the level of your collarbone at the back. It obviously curls under at the front, but it actually sits quite high there. And this can be a great source of stiffness and tightness for a lot of people who have neck pain, shoulder pain, tennis elbow, a lot of those issues that are common, but we don't necessarily associate with a stiff first rib. Again, with the previous video, with the chest exercises that we spoke about in terms of stretching your chest, being able to take some of that tightness away from the front, again, it's a consequence of the back first, but de-stiffening the back, freeing up the front can really open up and give you access to a whole bunch of shoulder flexibility and mobility that you didn't realize that you could have. Because one of the conversations we have with a lot of patients is, a lot of people feel like they're just naturally stiff and tight, mainly because they never really woke up from being perfect to be stiff and tight. It's often a gradual process of becoming that way. And as we talk about in all these videos, everything happens for a reason. So if you are stiff and tight at the back here and you can find it and clear it with the ball, we then have to make sure that you're addressing the key components of why that's stiff. And as you may know if you're following along, the single biggest reason why necks and upper backs get stiff is because we just put them in crappy shapes. So again, if you're sitting down a lot and you're in this position a fair bit, gravity acting on your arm, the weight of your arm is just constantly pulling and creating this tension in your upper back and neck. The only way your body knows is to adapt, and it basically starts to stiffen up those areas to deal with that constant increase in load. So if we're not then getting out of these positions into a better, more supported position, we can't expect that stiffness to go away long term. And if it's heavily linked to your shoulder pain, we can then sort of find it hard for that shoulder pain to go away and stay away forever, which is really the goal. And we know that if you can clear all this stiffness, work on making sure that your default postures are better, then that just doesn't have to be there. It's unless you've done some irreversible damage, which a lot of people haven't, even though it feels that way, there's always a whole bunch of normal function that you can reclaim that will help make that feel better. So that's just a quick little video on sort of how you can use the ball to improve one aspect of your range of motion. There's a lot of other things you can do, but I find it a really powerful exercise for a lot of people. It can clear a lot of neck, upper back, and shoulder dysfunction that you don't deserve to have. So give that a go. Please let me know how you felt it went in the comments. If you have any questions, please let me know. And if you enjoy the content, if you're getting something out of these videos, please subscribe to the channel. It really helps us out, but also it keeps you up to date with the new videos as they come out. So I appreciate you tuning in, and until next time, we'll see you later. Bye.